fever is a common problem in patients returning from travel abroad. Although malaria is often suspected, rickettsial diseases, including MurineTyphus, are generally not. This case indicates that MurineTyphus should be considered in the diagnosis of febrile illness in travelers returning from rural disease-endemic areas, particularly if fever is present and blood smears show no malaria parasites. Rickettsial diseases were recently cited as the third most frequent cause of imported fever in Switzerland, so rickettsial diseases may be underappreciated in returning residents to the UK, dependent on any variation in travel destination and activities. Other reports from France and the United States, MurineTyphus is a frequently imported rickettsial disease. Increased development of tourism and travel to tropical countries should lead to an increase in the documentation of cases. MurineTyphus, also called endemic typhus or flea-borne typhus, is a disease caused by a bacteria called Rickettsia typhi. MurineTyphus is spread to people through contact with infected fleas. People get sick with MurineTyphus when infected flea feces are rubbed into cuts or scrapes in the skin. In most areas of the world, rats are the main animal host for fleas infected with MurineTyphus. MurineTyphus occurs in tropical and subtropical climates around the world where rats and their fleas live. Cat fleas found on domestic cats and opossums have been associated with cases of MurineTyphus in the United States. Worldwide, MurineTyphus has been documented in diverse geographic areas, including the Mediterranean, Africa, Southeast Asia, and the United States. However, many clinicians do not initially suspect a diagnosis of MurineTyphus because of the limited geographic locations where it has been reported. MurineTyphus can mimic a long list of serious vector-borne infections, for example, Rocky Mountain spotted fever, ehrlichiosis and anaplasmosis, West Nile virus fever, babesiosis, and dengue, and non-vector associated infections, e.g., typhoid fever, invasive meningococcal disease, leptospirosis, viral and bacterial meningitis, measles, toxic shock syndrome, secondary syphilis, and Kawasaki syndrome. The ability of clinicians to suspect and diagnose MurineTyphus before receiving the results of confirmatory serologic tests will remain a challenge because physician awareness of this infection is limited as a result of MurineTyphus regional geographic setting and non-specific clinical presentation. However, MurineTyphus should be considered in the differential diagnosis if a patient presents with persistent fever of 3 to 5 days duration without explanation, if a history of exposure to opossum or cat, in Southern California and Texas, and flea contact is likely, or if there is a history of travel to tropical or semi-tropical environments where large rat populations are likely to exist. Empirical treatment with doxycycline should be started while waiting on lab results.